SARS, the forgotten pandemic that foreshadowed COVID-19, the emergence of SARS, severe acute respiratory syndrome, in late 2002 marked a critical turning point in global health preparedness. Though less devastating in scale than the COVID-19 pandemic, SARS served as a stark warning about the dangers of novel coronaviruses and the speed at which they can spread. The first confirmed case emerged on November 16, 2002, in Guangdong Province, China, originating in individuals working as food handlers in wet markets, environments where live animals, including poultry and exotic species like civet cats, were kept in close proximity. The initial delay in recognizing the outbreak allowed the virus to circulate undetected for 2 months, infecting healthcare workers before authorities fully grasped the severity of the situation. The disease rapidly spread beyond China, reaching Hong Kong in February 2003 via a nephrologist who traveled for a wedding, later dying from the infection. This transmission highlighted the virus's ability to move quickly through international travel networks. The World Health Organization, WHO, launched an investigation led by Dr. Carlo Urbani, who tragically contracted the disease himself while investigating a case in Vietnam and died that March. By March 12, the WHO issued an alert, and within days, the Centers for Disease Control and Prevention, CDC, named the illness SARS and identified a novel coronavirus as the culprit. The outbreak peaked within months, spreading to 28 countries, including 29 cases in the United States. More than 8,000 people were infected, with 774 fatalities, resulting in a case fatality rate of approximately 9.6%. Though frightening at the time, SARS was ultimately contained through aggressive contact tracing and quarantine measures. Further investigation traced the virus back to palm civets and raccoon dogs sold in live animal markets. Later, in 2017, scientists pinpointed horseshoe bats in remote Chinese caves as the original animal host, confirming that the virus could jump from wildlife to humans. The risk of future outbreaks was explicitly warned. The risk of spillover into people and emergence of a disease similar to SARS is possible. SARS proved to be a rehearsal for the COVID-19 pandemic, which emerged in late 2019. Both viruses belong to the same coronavirus family and likely originated from similar animal reservoirs. However, the response to COVID-19 was significantly faster and more informed, thanks to lessons learned from SARS. China, for example, had a rudimentary disease surveillance system in 2002, relying on phone calls and lacking standardized reporting. After SARS, the country rapidly built a comprehensive contact tracing and surveillance system, which proved crucial when SARS-CoV-2 emerged. The virus was identified within 2 weeks, compared to months for SARS, and vaccine development was accelerated due to prior mRNA research. Despite these advancements, some critical lessons were ignored. Experts warned against disturbing wildlife habitats, yet live animal markets persisted. Moreover, the relative ease of containing SARS and MERS created a false sense of security, obscuring the potential for a more widespread and difficult-to-control pandemic. The SARS outbreak stands as a crucial reminder. Emerging infectious diseases are not anomalies, but inevitable threats. The key to preventing future pandemics lies in proactive surveillance, rapid response, and a commitment to respecting the delicate balance between humans and the natural world.